Good day, ma'am. May I know your name and birthday?
I'm Jensen Hiles, January 15, 2009.
I am Giancarlo Obligacion, your student nurse from the Pinewood College of Legazpi School of Nursing, and I'm going to perform assessment of your thorax and the lungs. And in order for that to be successful, I'll be needing your cooperation. Is that okay with you, ma'am?
Okay.
Inspect the shape and symmetry of the thorax from posterior and lateral views. While the client sits with her arms at her side, stand behind her and observe the position of scapulae and the shape and configuration of the chest wall. Inspect the spinal alignment for deformities. The spine must be vertically aligned and the right and left shoulders and hips are of the same height. Palpate the posterior thorax. Palpation may be performed with one or both hands. Palpate for tenderness, warmth, pain, and other sensation. Palpate the posterior chest for respiratory excursion. Place your hands on the posterior chest well with your thumbs at the level of D9 or T10 and pressing together in a small skin fold. There must be a full and systematic expansion and the thumb must be separated to 3 cm during deep inspiration when assessing for the respiratory excursion.
1.
99, 99, 99, 99.
Percuss the thorax. Percuss for tones starting at the apices of the scapulae and across the top of both shoulders. Resonance is the percussion elicited over normal lung tissue. Percussion elicits flat tones over the scapula. Auscultate the chest using the flat disc diaphragm of the stethoscope. Place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lung at C7, then ask the client to breathe deeply through her mouth for each of area of auscultation so you can best hear inspiratory and expiratory sounds. There must be 3 types of normal breath sounds that may be auscultated: bronchial, bronchovesicular, and vesicular sound. Then inspect breathing patterns. Respiration should be even and smooth. Chest movement should be symmetrical. Inspect the anterior chest for shape and symmetry. Have the client sit with their arms at their sides, stand in front of the client, and assess the sternum from the anterior and lateral viewpoint. Watch for external detraction and observe quality and pattern of breathing. Palpate the anterior chest. Palpate for tenderness, sensation, and surface masses. Start with your hand positioned over the left ventricle and move your hand left or right, comparing finding bilaterally. Palpate the anterior chest for respiratory excursion. Place your hands on the client's anterior lateral wall with your thumbs along the costal margin and pointing toward the xiphoid process. Then thumbs must move outward in a symmetric fashion from the midline. Say 99 using the sequence for palpating the anterior chest. Palpate for primitus using the same technique as the posterior thorax.
Go.
The anterior chest systematically. Percuss the apices above the clavicles and then percuss the intercostal spaces across and down, comparing sides. Resonance is the percussion tone elicited over normal lung tissue. It elicits dullness over breast, heart, and liver tissue. Tympany is detected over the stomach and flatness is detected over the muscles and bones. Auscultate the anterior chest. First, place the diaphragm of the stethoscope firmly and directly on the anterior chest wall. Auscultate from the apices of the lungs slightly above the clavicles to the bases of the lungs. At the sixth rib, ask the client to breathe deeply through his mouth. In an effort to avoid transmission of sounds that may occur with nasal breathing, listen at each side for at least one complete respiratory cycle. Follow the sequence for anterior auscultation of the thorax. And then document findings in the client's record.